Greetings to everyone. Welcome to our YouTube channel. I am Dr. Rana Basil Mehmood and today we will discuss our new lecture. Let's start our video. First of all, we will talk about acute glomerulonephritis and hydronephrosis. चलिए वीडियो को एंड तक देखते रहिए. Now we will talk about introduction of acute glomerulonephritis. Acute glomerulonephritis is a common disease in children and it is one of the diseases that are presented commonly with hematuria, which means red urine. Acute glomerulonephritis in all probabilities results second to a preceding streptococcal infection of throat or skin, a history of upper respiratory infection. Then we will talk about definition of acute glomerulonephritis. Acute glomerulonephritis is an immune-mediated inflammatory disease of the capillary loops in the renal glomeruli. The antigen-antibody complex decomposition within the glomeruli results in glomerular injury, which is manifested as hematuria, oliguria, edema, and hypertension. After that, we will talk about anatomy and physiology. The kidneys are pale reddish and bean-shaped organs located in the peritoneum and the posterior wall of the abdomen. The kidneys are located between the levels of the last thoracic and third lumbar vertebra, a position where they are partially protected by 11th and 12th pair of ribs. The right kidney is slightly lower than the left because the liver occupies considerable space on the right side superior to the kidney. Then we will talk about functions of the kidney. इसके 4 functions हैं. First one है homeostasis function. इसके अंदर include है excreting waste and foreign substances. Second one है maintenance of water balance. Third one है maintenance of electrolyte balance. And fourth one है maintenance of acid base balance. अब हम सेकंड पॉइंट की बात करते हैं जो कि फंक्शन ऑफ किडनी में इंक्लूड है. वो है हीमोपोइटिक फंक्शन. थर्ड वन है एंडोक्राइन फंक्शन. एंड फोर्थ वन है जो कि है रेगुलेशन ऑफ ब्लड प्रेशर. आफ्टर दैट वी विल टॉक अबाउट etiology. फर्स्ट वन है प्रीसम्ड कोज एंड सेकंड वन है इनिशियल इन्फेक्शन. प्रीसम्ड कोज में इंक्लूड है एंटीजन एंटीबॉडी रिएक्शन सेकेंडरी टू एन इन्फेक्शन इन द बॉडी. एंड इनिशियल इन्फेक्शन में इंक्लूड है यूजुअली ईदर एन अपर रिस्पिरेटरी इन्फेक्शन और अ स्किन इन्फेक्शन, यूजुअली 1 to 3 weeks before the onset of symptoms. After that, we will talk about clinical manifestation. First one है urinary symptoms and second one है edema. Urinary symptoms में include है decreased urine output and second one है bloody or brown that is colored urine. अब हम बात करते हैं edema की. इसके अंदर include है present in most patients, usually mild, often manifested by periorbital edema in the morning and may appear only as rapid weight gain. And last one may be generalized and influenced by posture. After that, we will talk about hydronephrosis. First of all, we will talk about introduction of hydronephrosis. Hydronephrosis is a condition in which one or both of the kidneys become stretched and swollen. This is usually because there is a blockage somewhere in the urinary system, which is the usual cause, or urine inflowing from the bladder back to the kidneys. It can sometimes cause a pain in the side or there may be no symptoms at all. After that, we will talk about definition of hydronephrosis. Hydronephrosis is distension and dilation of the renal pelvis and calces, usually caused by obstruction of the free flow of urine from the kidney, leading to progressive atrophy of the kidney. Then we will talk about signs and symptoms. The signs and symptoms of hydronephrosis depend upon whether the obstruction is acute or chronic, partial or complete, unilateral or bilateral. Unilateral hydronephrosis may occur without any symptoms. First one है asymptomatic. Second one है pain is felt in the renal area. Third one है hematuria. Fourth one है urinary infection dysuria frequency. Fifth one है renal calculi. And sixth one है azotemia. After that, we will talk about managements. Treatment of hydronephrosis focuses upon first one है the removal of the obstruction. Second one है drainage of the urine that has accumulated behind the obstruction. And third one है the antibiotics are used to prevent the hydronephrosis from causing kidney infections. Then we will talk about surgical management. इसमें include a nephrostomy and ureteric stent. Acute obstruction of the upper urinary tract is usually treated by the insertion of a nephrostomy, an artificial opening created between the kidney and the skin which allows for the drainage of urine directly from the upper part of the urine system, that is tube. अब हम बात करते हैं ureteric stent की. Chronic upper urinary tract obstruction is treated by the insertion of a ureteric stent, जो कि है a thin tube inserted into the ureter to prevent or treat obstruction of the urine flow from the kidney. Then we will talk our last slide, जो है prognosis. Early detection and prompt treatment has good prognosis. Left untreated bilateral obstruction occurring to both kidneys rather than the one has a poor prognosis. I hope कि ये all information आपके लिए helpful होगी. Don't forget to subscribe our channel. Thanks for watching our this video.